KCBS, in partnership with UCSF Health, presents As Prescribed, a weekly conversation with leading medical experts from UCSF Medical Center and UCSF Benioff Children's Hospitals.
Hello and welcome to As Prescribed. I'm Alice Wertz. Today we're discussing new advances in the early diagnosis and treatment of Alzheimer's disease. It affects more than 6 million Americans every year and their family members. It's the most common type of dementia in older adults, and recently, UCSF has helped develop what soon could be a blood test for detecting Alzheimer's disease. Today, we're speaking with Dr. Gil Rabinovici, a neurologist and director of the UCSF Alzheimer's Disease Research Center. Thank you so much for joining us today, Dr. Rabinovici.
Thank you for having me, Alice. It's a pleasure to be here.
Thank you. It's wonderful to have you. I'd like you to share a little bit about what the difference between dementia and Alzheimer's is.
That's a great question, Alice. And so dementia means that someone has a decline in their memory or cognitive abilities that interferes with their ability to function. They can't do their taxes, they have trouble managing their checkbook, ultimately they have trouble managing more basic things. Now, dementia can have different causes. It can be due to brain trauma. It can be due to multiple strokes. The most common cause, however, of a slowly progressive dementia is Alzheimer's disease. And when I say Alzheimer's disease, what I mean are very specific biological changes that occur in the brain. There are proteins called plaques and tangles. These are basically toxic proteins that deposit in the brain, interfere with the functioning of brain cells, and ultimately lead to people losing brain tissue. And so these plaques and tangles, those specific changes are what define the disease. For many years, when I went to med school over 20 years ago, we were taught that the only way to know that someone has Alzheimer's disease for sure is to actually look at the brain under the microscope and look for these bad proteins, plaques and tangles. During life, we might suspect that someone has the disease if they develop progressive memory loss, especially in older age, but there was no way to know that for sure. And one of the major advances that we're going to talk about today are new techniques that allow us to directly detect these bad proteins, the plaques and tangles, not after someone has passed away, but during life. And we can do that with advanced brain imaging techniques. We can do it by measuring the levels of proteins in the spinal fluid of people. But really exciting is this advance that allows us to detect proteins in the blood. Just a simple blood draw can tell us whether people have plaques and tangles developing in their brain. And what's really interesting is that we can detect these plaques and tangles not only at the point where people have memory loss or dementia, but we can actually detect them probably 20 years or longer before people develop even the earliest signs of memory loss. So it's like being able to take a peek into what's going on in the brain, identify some changes that are occurring, and these changes then tell us who might be at risk for developing memory loss and dementia in the coming years.
So this blood test, tell us more about that and what the benefits are of getting the blood test done.
Sure. So I might take a step back and tell you a little bit about how we commonly diagnose Alzheimer's disease in the clinic now, which is we do a careful interview with patients and often with family members to hear about their memory symptoms. We review their other medical conditions. We review the medications that they're taking to make sure that they don't interfere with memory. We do some memory testing, usually paper and pencil tests to test memory and other aspects of cognition. And often we do a brain scan like a CT or a brain MRI just to make sure that people don't have a stroke or evidence of head trauma or something else that might be causing their symptoms. And then at the end of all that, if the story sounds typical for Alzheimer's and we've excluded other medical causes, we can diagnose someone as probably having Alzheimer's disease. When we do that, however, in people with dementia, even as experts, we're right only about 70% of the time. About 30% of the time, people might have dementia due to other causes, and sometimes these are actually treatable or reversible causes. And so what we've been looking for a long time is that definitive test that can tell us not only are the symptoms a good match for Alzheimer's, but can we directly detect, do we have biological evidence for these proteins, the plaques and tangles in the brain? And the blood test is the most exciting, I would say, advance in diagnosis of Alzheimer's disease, because with a simple blood draw, we can measure the levels of a protein called p-tau. That's short for phosphorylated tau, but I'll just say p-tau. And this is actually the protein that deposits and forms tangles in the brain. It's present in very low concentrations in the blood. But for the past 4 or 5 years, we've been working with scientists at Eli Lilly, one of the pharmaceutical companies, who developed a new technology that allows us to detect proteins in the blood that are present at very low concentrations. And working with Eli Lilly, we've been able to show that in people who have plaques and tangles in the brain, the levels of this p-tau protein are elevated compared to people who don't have plaques and tangles. And the accuracy of the test is very high. It's over 90% accurate compared to other measures we have, like advanced imaging tests called PET scans that are very accurate, but actually very expensive and not accessible to most people. And so using those imaging tests, we've been able to show that the blood test is a very, very accurate measure about who might have plaques and tangles in the brain. So how does that help? Well, in the scenario that people have symptoms of memory loss, it gives us that direct test evidence that they do have Alzheimer's disease. It's not just probably they have Alzheimer's, but we have direct biological evidence that there are plaques and tangles in the brain. And so we can provide people with a definitive diagnosis and start to think about a treatment plan. And we can talk about what that treatment plan might entail further down in the interview. In people, right now we're thinking that that's going to be the main role of the blood test when it enters the clinic, is to help provide a definitive diagnosis of Alzheimer's disease. Now, I told you earlier that people have plaques and tangles that develop in the brain before they have symptoms. And one question is, would it be valuable to have that information? Would it be valuable for people to know that they have changes in their brain that might put them at higher risk for developing symptoms of Alzheimer's disease? And can that in turn help us not only diagnose the disease once people have symptoms, but diagnose the changes in the brain before people have any symptoms and intervene either with lifestyle measures or with treatments that can actually reduce the chances of them developing memory loss. A good analogy that I would use for that is how we get our cholesterol measured at our annual visit. So we know that high cholesterol can be a risk factor for developing heart attack and stroke. We measure our cholesterol, and if it's high, we institute changes in our diet and lifestyle, or maybe even try a medication to lower our cholesterol. And we know that by doing that, we reduce the chances of developing a stroke or a heart attack. Similarly, we might, at a certain age, start to get a blood test that will tell us if we have this high levels of the p-tau protein that put us at higher risk for developing memory loss. And if we do, we might institute lifestyle changes and potentially intervene with medications that can prevent the development of symptoms.
That's fantastic news. Are there barriers to getting this blood test to prime time?
You know, I think it's very close to prime time. A lot of the research that's been done with the blood test has been done at academic centers like UCSF. So we have very specific protocols for how we draw the blood, and then we spin it around and we freeze it. And we have very specific protocols. And so we still need to show that we can, that the blood test is still accurate at any typical commercial lab, and that using the typical protocols that all of us get for our typical blood tests and our doctor visits, that we can still measure this protein reliably. So that's something that is currently being done to make sure that in the real world clinical practice, the blood test is accurate. Another really important thing that we're actively doing now is testing the validity of the blood test in more diverse populations. So unfortunately, like a lot of medical research, the initial studies on this blood test have primarily been performed in non-Hispanic white research participants. And what we're doing now at UCSF and at many other centers is making a huge drive to make our research more open and accessible to minoritized populations, and to make sure that the blood test is valid in the more diverse group of older Americans. We know that older Americans in the US are a very diverse population, and we want to make sure the blood test performs accurately in a population that truly represents the people who are suffering from this disease.
How can these innovations impact a patient's treatment or diagnoses?
Well, Alice, first of all, it can give patients a definitive diagnosis. They can rest assured that we haven't missed anything else. And even though it's not the news that they would like to hear, it really changes the compass from searching for a diagnosis to thinking about a treatment plan. There are lifestyle modifications that we can actually make to protect our brain against Alzheimer's. These include eating better, sleeping better, exercising more. And studies have shown that people who have a diagnosis are actually more motivated to make these lifestyle changes and stick with them. And really exciting is that these advances in diagnostics are coming hand in hand with advances in developing new treatments. Just a couple of weeks ago, the FDA approved the first drug that directly removes plaques from the brain, changes the biology of Alzheimer's disease. This isn't a cure, but what it does is it slows the rate of memory decline. And so now by getting that definitive diagnosis, that can also open the gateway to a new treatment for patients who are in early stages of Alzheimer's.
That's very exciting. Keep up your wonderful work there at UCSF. Thank you so much for joining us today, Dr. Rabinovici.
My pleasure. Thank you so much.
We've been joined today by Dr. Gil Rabinovici, who's a neurologist and director of the UCSF Alzheimer's Disease Research Center. You've been tuning in to As Prescribed. I'm Alice Wertz.
As Prescribed, every Thursday at 1:30, right here on the Bay Area's news station, All News 106.9 and AM 740 KCBS, and streaming on the Odyssey app. The proceeding was sponsored by UCSF.